right. Thank you all. We are letting people into our meeting right now. So for those of you who are in, we welcome you and wish we were with you on the banks of the Pamlico or on the shore in Carteret County. Thank you all very much for being with us. I am Peg O'Connell. I am the chair of Care for Carolina, which is a coalition of 66, as of this morning, North Carolina organizations that are dedicated to finding a North Carolina solution for closing the coverage gap. We are delighted to have this Eastern North Carolina business-focused forum and roundtable to discuss what closing the coverage gap can mean to Eastern North Carolina. First of all, I would like to say that we may be joined by a reporter, and I think Chris Day from the Daily Advance from Elizabeth City, I think is on with us. So we welcome you, Chris. I will say this is an educational meeting and comments are off the record, although I am sure that all our speakers would be happy to talk with you at another time to do some on the record interviews. So again, Chris, if you're out there, we welcome you. Good, it is Chris. Thank you very much, Chris. I hope things are good in Elizabeth City. And from what I hear, you're getting some rain. So it's my pleasure to thank our co-sponsors for this lovely event that we're having. First of all, the NC East Alliance. Dan, you have been just a wonderful partner in this, and we thank you for bringing so many of your friends. We've got the Carteret Chamber of Commerce. You all have been long supporters, and Dr. Ronnie Bell, who cannot be with us today because he is literally out saving the world, has agreed to be the co-sponsor from the East Carolina University School of Public Health. Dr. Bell is a tremendous advocate for public health and was one of the very first members of the Care for Carolina Coalition. So we are proud to have East Carolina University School of Public Health as a co-sponsor as well. So I will give you a couple of technical pieces of information, and then we will move on, and I will let the man from down east give you a couple words of welcome. So first of all, you'll all be on mute. And so if you are going to have a question, we're going to save questions for the end so we don't get out of time for all the important things we're going to be talking about today. But if you do have a question, go to the bottom of your screen and you will see participants, of which right now there are 48, which is very cool. So you're on mute. If you have a question, go to the participants, click on it, and then the list of participants will come up on the screen, and you'll get a command that says raise your hand. So when you do that, then at the discussion time, I will be able to call on you. So it's, if we were together, this wouldn't be an issue, but it's the way it is these days. So, and then Haley will unmute you so we can actually hear your voice and get your question. And again, if you'll hold your questions to the end, I think, and then one fun thing, because you are our new best friends from down east, you are also going to get an executive level briefing on the poll that we released yesterday. So you may be some of the first people, other than a few reporters, to see this interesting news that Erica will share at the end of her presentation. So without further ado, it is my very great pleasure to ask Van Rogerson, who is the president and CEO of the NC East Alliance, just to say a minute of welcome, and then we will get to the meat of our conversation. Van?
Good afternoon, everybody. I know a lot of you, and as you know, the last 20 years I've focused on rural economic development. And I have spent a lot of time bringing new businesses into the rural East. I ride them around. I see I see our region through their eyes, and I can promise you good health care is expected, and it is critical for our future. Last year when I became president, I became a little more concerned and focused on rural health care because OBGYN in Williamston closed. Williamston is where I live. Next door in Washington County, Plymouth, that hospital opened, closed, opened. You just started seeing a struggle of our rural hospitals, and then COVID hit. So all of a sudden, I became very worried when I started thinking about the compounding economic burden that these factors have on our rural hospitals and our rural doctors' offices. So when I started thinking about the cumulative negative impact of COVID at the hospital on their cash flow, impact on the doctor's office's cash flow, effect on our counties. Our counties are often the partners with the hospitals, and their budget struggles. City and town budget struggles. But when you add COVID on top of the cost of the insurance gap, when Meg Malloy and Erica Smith called and was asking if we'd like to participate with them with this, I told them yes, I would like to hear the facts about those issues because I am concerned about our rural region's future. So I'll turn it over. I'm glad to be with you. Thank you for including us.
Van, thank you very, very much. You struck just the right tone to kick off our next speaker. So to talk to us about the economics of COVID and the uninsured in Eastern North Carolina is a man I call my favorite numbers guy, Jason Gray, who is a senior fellow for research and policy at the NC Rural Center. So Jason, take us through the numbers, please.
Good afternoon, everyone. It's a pleasure to be here with you. So closing the coverage gap, Medicaid expansion, has been one of the key priorities of the North Carolina Rural Center since early 2016 when we developed our rural counts policy agenda. We recognized early on that getting better healthcare coverage has huge economic value throughout rural North Carolina. Van referenced some of the challenges that rural hospitals face. It's also challenges faced by primary care shops, and the pandemic has accelerated that. So I'm going to focus my comments both on the general economics of closing the gap, and then a little bit of information on what this means in light of the pandemic. Next slide. So we've got a pretty good estimate of the economic impact of the coverage gap in North Carolina. It's far less certain, but what the pandemic has done, I'm going to give an estimate, but it's real back of the envelope. The reality is that it's going to take a while to really understand what the pandemic is going to do in terms of healthcare coverage. And then finally, there's mounting evidence that the pandemic has had resulted in diminished revenue for outpatient hospital services and general practices. This is critical for practitioners serving rural and low-wealth populations. Next slide. So I'm going to be sharing some economic impact analysis numbers that come from a report that an analysis done by the George Washington University in Washington, D.C., their School of Public Health, the Milken Institute of Public Health. Next slide. This report was commissioned by the Cone Healthcare Foundation and the KP Reynolds Foundation, both of which have a sort of a healthcare focus. This report used an economic modeling program, probably known to most of the folks here on this call, the Regional Economic Models, Inc., REMI. As you know, REMI is one of the major economic modeling programs. IMPLAN, another. REMI examines the flow of revenue and outputs in local and regional economies that generates estimates around and the deep economic impact across the region. REMI is used by a variety of North Carolina state government offices, Congressional Budget Office, the White House Office of Economic Advisors. It's even used by the economic development partnerships across the state. It's a commonly used modeling program. Is it perfect? Probably not. No projection system is going to be as accurate as looking in the past and measuring impact. But it's widely used, viewed as reliable and commonly used. Next slide, please. So we took the numbers from the George Washington University study. We were able to get from them the county estimates. And then I broke it out by the rural, suburban, urban county classification system that the Rural Center uses. And this is what we've come up with. And I'm gonna, I'm a rural guy, so I'm gonna focus on the rural numbers. I'm sure this presentation will be made available to you. But from the updated report that was done last year, from 2019 through 2022, they're estimating over 11,000 rural jobs, 279,000 new Medicaid enrollees. And here's the things, and it's why the Rural Center got involved in this, is an estimated $1.9 billion of over economic impact and $33.6 million in local tax revenue. Okay, next slide. So I've also broken out the data by the tiers, our beloved tier system. I say that with great irony. Tier 1, our most economically distressed 40 counties in the state, estimated $1 billion of economic impact. $13.9 million in local taxes. So let's take for a second, and Haley, if you would please just back up one slide for me, if you would. Back to the roll. Okay, so let's assume that these numbers are not accurate. So I've just gone in and I've reduced a couple numbers by 25%. Let's say we've overstated it by 25%. I ratcheted it back 25%. That $1.9 billion in rural impact is still $1.4 billion of economic impact. The $33.6 million in local tax revenue gets knocked back to $25 million of local tax revenue. Next slide. For the tier 1 economic impact, reduced from $1 billion to $753 million, and the local tax revenue from 13.9 million to 10 million. So even if the numbers are overstated a little bit, and I have no reason to believe that they are significantly overstated, but I just want to illustrate this, that even at a lower target, there's hardly anything we could do for Eastern North Carolina, rural Eastern North Carolina, that would have the economic impact of North Carolina joining most of the rest of the country and having some system to assure that we've got healthcare coverage for individuals. Next slide. Okay, so here's just a smattering selection of impact for individual counties. Hertford County, one of my favorite counties in the East, because I had the pleasure of spending a lot of time there last year. Estimated 138 jobs, 1,600 new enrollees, $15 million in economic impact. There's a small hospital there in a Hosky, and $150,000 in local tax revenue. Pitt County, understandably, would be much greater because of the concentration of medical services in Pitt County. $115 million of impact and $1.8 million in local tax revenue. Duplin County, $21 million in economic impact, $300,000 in revenue. So I mean, even in the economic impact numbers are really driven by the number of healthcare, primary healthcare jobs created that then ripples through the rest of the economy. So the impact is far greater in urban counties that have a major medical presence than in rural counties where that presence is small. But even in smaller counties like Duplin, Columbus, and Hertford, that impact is real. And it provides that infrastructure, that health ecosystem that, as Van noted, needs to be present for the communities to be competitive. Next slide. So we have run the numbers by the Economic Development Partnership regions. This is new jobs. And as I said, in terms of the healthcare prominence in our urban areas, you know, the Triangle, the Charlotte region, they have the vast share of jobs. But even in eastern North Carolina, northeastern North Carolina, we're looking at 1,259 jobs, 2,500 jobs in the southern half of the eastern part of the state, 2,500 in the Sandhills area. Next slide. Again, an economic impact, $233 million in northeastern North Carolina. Now, again, let's say that's overstated a little bit and say, yeah, it's only 200 million. That's still a pretty significant economic impact. Likewise, in the southern tier, 500 million. Am I reading that right? 500 million, 458 million in the Sandhills. Next slide. And then regionally, tax revenue, 3.2 million in the Northeast, 6.9 in the southern tier, 6.1 in the Sandhills. And this now is particularly important because we are just coming to terms with the fiscal implications of the pandemic on rural counties in particular, who always had very thin margins in terms of their budgets, and with loss of business, loss of sales taxes, our rural local governments are going to be even more pressed. Next slide. So shifting a little bit to the impact of the pandemic. So from January to July, which is the most recent local county level employment numbers we've had a reduction in employment. And I always look at the number of people employed rather than the unemployment rate, because the independent variables are in unemployment rate. So I look at the bottom line is that what is the change in the number of people employed? So that's a standard practice I use here, use at the rural center. So for in the 80 rural counties, there was a 5% reduction in employment, 94,215. In our 14 regional city suburban counties, Pitt County, for example, we classify as a regional city suburban county. 8% decline, 105,000 fewer employed. In our 6 core urban counties in the east, that would be New Hanover County, Wilmington, a decline of 155,000 jobs, again, 8% decline. So what's interesting about this is that while the economic impact across rural North Carolina and rural America is very real, this is a bit of a flip from the Great Recession, where the rural economic, the impact was greater in rural counties than it was in urban counties. Here, because the pandemic hit first in retail, restaurants and accommodations, which tend to be clustered in urban areas, the impact has been weighted a little bit heavier in our urban areas. But still, across those rural counties, the impact is real, especially as the pandemic deepened and it shifted from the retail, food and accommodation sector and started to ripple through manufacturing and wholesale and other sectors. So for a total, so far through July, and again, this is the last localized numbers we have, 354,540 fewer people employed, a 7% decline. That's a real hit. Now, these July numbers are significantly improved over May. I did a similar presentation sometime in the middle of the summer, and I was using May numbers. So things are improving. what happens over the next couple months, you know, that's above my pay grade to be able to estimate. Next slide. Okay, so another way of looking at this is through unemployment insurance claims, because one of the big questions we're being asked, and we had a Spanish radio news team visiting us at the Rural Center yesterday, and they asked this question: is that of all the people who've lost jobs, how has the pandemic affected the number of people without health insurance? And the short answer is that it's hard to estimate. Okay, so this is kind of a back of the envelope, thinking out loud piece of the presentation. So, State Department of Commerce is doing a good job at tracking unemployment insurance claims. Many of you have seen this dashboard that's been developed. And for July, we had some 365,000 continued claims that have been filed in previous months. And 255,000 of them were deemed to be COVID related. I'm not sure how they determine that, but those are their numbers. And it comes from Commerce, so we know it's a pretty good number. Next slide. So we have 365,000 continued claims, 255,000 COVID related claims. The COVID claims are 70% of the total. So we've had a huge increase in the number of unemployment insurance claims filed. Next slide. So how can we estimate what the increase in the number of those in North Carolina without health insurance? The typical number used for North Carolinians in the coverage gap comes from reliable estimates from the Kaiser Family Foundation, which has a particular specialty in health policy analysis. So we're looking at between 400 and 500,000 people in the state that chronically have not had health insurance. So we've got 255,000 people that are COVID related claims. Next slide. And whoa, back up, please. I think I missed something here. Okay, there we go. So the Commonwealth Fund, another health policy foundation, their estimate is that around 21% of the people in the newly employed as a result of the pandemic are without health insurance. You know, figure a couple, the man has health insurance through his wife's employment. He loses his job. Okay, so he shows up in the unemployment numbers, but he still has health care coverage. So that's the complexity in trying to understand this. But Commonwealth Fund, they've come up with a mechanism, and their estimate is 21%. How certain am I of this 21%? You know, not very, but there's very few estimates out there that we can work off of. So I just want to use this as an example. So at 21%, that's 53, almost 54,000 additional people in the coverage gap as a result of the pandemic. Now, again, this number is because the UI claims numbers have decreased as PPP kicked in and the economy began to improve. This estimate went from over 100,000 from the May UI claims to this 53,717 in July. So again, we're seeing some improvement, but undoubtedly, the pandemic has created, in addition to the unemployment impact, has aggravated the number of people in North Carolina who were without health insurance, people who were working. Okay, next slide. I don't need to dwell on this because this is a topic that's actually been in the news significantly, both in the national press and a little bit in North Carolina, that one of the perverse impacts of the pandemic is that non-essential services at hospitals got canceled or put off. So there was a revenue stream that lost to hospitals. private practices seeing a decline in foot traffic, people coming in for appointments because of the fear of infection. The Journal of the American Medical Association in June sort of collected some survey work being done around the country on the impact that the pandemic is having on medical practices. And as we see here in my brief notes, that the impact is uniform and is fairly severe. It was interesting to note that the pediatrics in particular have been hard hit because they're serving young people, and many medical practices are relying on Medicare and Medicaid patients, to underwrite their revenue. But kids don't have coverage when they may have it under Medicaid if the mother does, but certainly they're not going to be eligible for Medicare. So this is a very real worry. We did a briefing last week, I believe, focusing on Western North Carolina. We had some health clinic folks as panelists, and they documented in some detail and worry that the impact that the pandemic was having on health providers. Next slide. Okay, closing points. This is my closing case statement. Medicaid expansion, closing the coverage gap, has substantial benefits that advances economic competitiveness under the best of conditions. The Rural Center exists to help increase the economic competitiveness of rural places, quality of life factors, healthcare coverage, quality schools, quality having access to broadband, quality housing, which is a whole nother issue that we're beginning to pay attention to. All of y'all who are doing economic development work in Eastern North Carolina know that these are huge quality of life indicators that help you grow your existing businesses and recruit new ones. So this is a huge policy decision that has tangible economic outcomes for rural North Carolina. Two, in light of the pandemic's disaster, closing the coverage gap would support a substantial number of North Carolina citizens who find themselves without coverage. Finally, while not the sole solution, closing the coverage gap would generate increased revenues to economically devastated healthcare providers. So that's my points. I look forward to any questions and conversation that generates, and I will turn it back to Peg now. Thank you.
Thank you, Jason, very much. We appreciate you taking us through the numbers in an explainable and understandable way, so that we can actually see what is going on in Eastern North Carolina and all over our state. And we do have a question for you in the chat box, but we will save that to the end because other people might want to chime in on that as well. So it's now my pleasure to introduce our next speaker, who's going to talk about the Virginia story of Medicaid expansion, what happened just north of us. And for those of you who are in the Finger Counties, this is probably where you all go to shop and listen to the news. So we appreciate you turning your focus to North Carolina right now. So Anna James is the Senior Vice President for Public Policy and Government Relations at Centera Healthcare. And she is new to our table, but we are absolutely delighted to have her. So Anna, if you will take it away, we would love to hear what happened up in Virginia.
Great. Thank you so much, Peg. And thank you so much for having me today to talk about the Virginia experience and kind of our fight for Medicaid expansion. Now, I will say it took about 6 years. So we're happy to have the perseverance that we had, but just knowing that it took a long time. It wasn't just overnight that we did convince our General Assembly and our leadership and elected officials to expand Medicaid. So I'm really excited about the opportunity to speak more about that, as well as hear more about what this group is doing and really trying to advocate for all of those uninsured in North Carolina. Next slide. I think it's good to see kind of what is the impact of Medicaid expansion and a little bit of background on our fight in Virginia. Again, it was 6 years. We started expanding Medicaid to January 1st of 2019. So we have a year and a half under our belts of kind of what the impact was. And then seeing it firsthand at Centera Healthcare has been absolutely amazing. A little background, Centera, we are the largest health system in Virginia. We have 12 hospitals. We do have the hospital down in Elizabeth City. I'm proud to be part of that community. We also are the second largest employer in all of Virginia with over 30,000 employees. So really you can see the impact to our healthcare workforce, to our communities, as well as the economic impact to all of Virginia, because we are statewide. We do also, which came into play, own the largest Medicaid managed care company in Virginia. We're Optima and Virginia Premier, two of our companies. And we serve over 600,000 Medicaid lives through our health plan and our Medicaid managed care company. So we saw it both on both sides, the managing of care and making sure that we have access in our hospitals and our medical practices, as well as the feeling of being insured on the health plan side. So the slide before you shows you, this is based on August 31st data of how many individuals have enrolled into Medicaid expansion. We predicted about 350,000 to 400,000, and as you can see, we have 456,000 individuals that were eligible and have signed up for Medicaid. Again, there was 128,000 were newly enrolled adults as parents. And I think this is very key about the types of individuals in the case that we made for Medicaid expansion, that it wasn't, believe me, the conversations I had with General Assembly members about who actually is eligible, those that are working, what we would call kind of the working poor, the lower income individuals, 70% of those that were eligible and were working, as well as, again, predominantly a lot of them were parents. And so their kids would be covered under our prior eligibility requirements for CHIP and Medicaid, but their parents were not. So I think that was really a key message to make. As well, you can see it's predominantly women, 56%. You can also see the age breakout of kind of where they're mostly the 19 to 34-year-olds. And that's something we're very proud of, because those are individuals that don't feel they need insurance or know the value of Medicaid. And so we did a huge education push for this part of the population to say why it's really important to be insured. So that was, so we're happy to see those numbers, as well as you can see that most of the individuals were below the 100% FPL. And that was one of the other discussions that we had, or these are the individuals going back and forth on the exchange. But we've seen that these are the neediest and most vulnerable populations that we had in Virginia. So I thought this was a pretty good representative of those that did sign up and those that are eligible, to kind of give you the breakdown. I don't want to compare it to what our projections were. We knew it'd be more women, but the parents, I think, was surprising in that more parents signed up than what we had originally projected. And that's a really good story to tell. The next slide would be great. Here's what I thought is, so we know the numbers, but really what is the treatment and some of the issues we found. So in Virginia, we really focused on the business case for Medicaid expansion, and I'll get to that a little bit later, but we also talked about the changing lives and the impact on the folks' lives that we want to serve in our uninsured population. So it's good to see that they are receiving the services. At the beginning, we had a little bit of issues about access and making sure that our providers in Virginia were signing up for Medicaid, both through our managed care organizations as well as fee-for-service. And so you can see that part of the Medicaid managed care companies within their contract is that with this newly eligible population and newly insured, that they did have to do a screening or a checkup. Because if you think about it, a lot of these individuals never had health care before, or it was very piecemeal within free clinics and FQHCs. And so really to get them on that path to have better lives, and actually for the Medicaid expansion to really work in what we wanted to do, which is have healthier communities, it was really key to get that initial screening and checkup for each of the individuals that came on Medicaid. And so some of the things that we have found through this dashboard is look at how many are now being treated for diabetes, 37,000 individuals. 364,000 prescriptions were given. So these are individuals that needed this health care that didn't have it prior. The one office visit, that was something that we really, really pushed. And I know from the Optima and Virginia Premier Medicaid MCO standpoint, I think we have up to 80% of the individuals have seen a doctor within the first year. And that was one metric that we really tried to push on the managed care side, is getting these individuals a medical home, because that is, we know that's going to be the most success for their healthcare in the future. Asthma, 16,000. Cancer was very eye-opening. 8,700 individuals are now being treated for cancer. And I can say most of them didn't know they had cancer. And it's been very unfortunate how many individuals we have found who had stage 4 cancer, and it was at the very end, and it was pretty much that news that they got, and a lot of it was preventable if you knew in stage 1. So we have multiple stories. Cervical cancer, younger women dying of that when they found out it was too late in Southwest Virginia. It's just a really sad story, because things that we see every day as preventative care, as screenings, these individuals that Medicaid expansion didn't have access to that. And I think that was very eye-opening. So we have it was very unfortunate that we fought for 5 years to get this, and just think of all the lives, those that didn't make it, for those that were uninsured. And then COPD, as well as one of the benefits that we added, that I'm happy to talk at a later time, is really addiction recovery treatment services. We call it the ARTS program in Virginia. This is your opiate and any kind of substance abuse. And we have found with this newly insured that there are individuals that are suffering from a mental illness and a substance abuse. And so we really increased the amount of services that we provided through our Medicaid population. You can see 34,000 are taking, they are involved in that. And it's been really helpful, because we really want a holistic approach to healthcare. So, and you can see those individuals. So next slide. I thought it was important to kind of talk about the fight that we had and all of the myths and facts as it relates to Virginia Medicaid expansion. And I know you are hearing this in North Carolina, because I know we are hearing it, me and my team, trying to kind of talk about this as it relates to, you know, the good it does and some of the misconceptions, especially as it surrounds the cost of Medicaid expansion. And I think in Virginia, that was our best argument. So in Virginia, it was $2.6 billion that would flow through our economy with Medicaid expansion. That included 36,000 new jobs, and that's what we used. In addition, in Virginia, our FMAP, or your match of, you know, state dollars to federal dollars, was 1-to-1. So every dollar that the state put in, we got $1 match for Medicaid for the current population. And we were using a lot of that 1-to-1 match for services that Medicaid expansion would provide, where we would put in $1 and we get $9 back. And so really kind of having that conversation about the differential and match. So for behavioral health services, our indigent care, our DISH dollars, we had the 1-to-1 match, and some of that we could have done through the $1 for $9. And so really kind of breaking it down on how, I know Medicaid is, for the business community, it's probably foreign. And I always say Medicaid is government at its best. They make it very complicated. And so really breaking that down, your match and what you receive back. The other argument we had is that we are already sending all of this money to DC and getting nothing in return. We are paying the same taxes that we would pay with Medicaid expansion without. And so thank you, North Carolina, for paying your taxes so Virginia can have Medicaid expansion. We appreciate it, but we were on that same path too, that it was still the same taxes that were going up. In addition, there's no increase on state taxes, so state taxpayer dollars, because we did implement a provider assessment. And so that's when the hospitals put in money to pay for their share of the cost. And so with the 90% the federal government and the 10% being the state, we did impose a provider tax on our hospitals. And so the hospitals are paying the 10% of the cost of Medicaid. So there's no state taxpayer dollars, how we say it, going to pay for Medicaid expansion to bring that $2.6 billion running through our economy and creating the 36,000 jobs. The other myths that we had are that premiums for the insured will increase. And that's actually opposite of what happens. And so premiums are, in the commercial market, premiums and your reimbursement is higher than usually the cost in most cases for providing the care, because in order for hospitals to succeed and to actually be able to operate, not close, you need a little bit of a margin to actually run your hospitals. And so commercial market usually pays above and Medicaid pays below. So there's always that subsidization of those that are uninsured, because again, if you think of, can any other business run if you're getting paid below the cost of care or the cost of your service or the cost of your good? No other hospital, no other industry out there is the same as healthcare and how hospitals run. And so kind of reminding folks of that argument that some of your premiums are paying to keep your hospitals open also worked. The other things, we had a lot of discussion about work requirements, that these individuals wouldn't get a job if they had Medicaid expansion, and 70% of those individuals that were eligible were already working, and said that they would work moving forward. And so we had a lot of discussion about that. The original concept was to have a work requirement on it, but we know there's been a lot of politics around that, and that has been taken out. We did file a waiver, but we did pull the waiver for multiple reasons on either work supports or work requirements, just because of a lot of the issues. But happy to talk about kind of, that was a piece that helped kind of make the case that these individuals are working, so it shouldn't be hard for them to, check the box on a work requirement. The other thing that we found, Virginia is a very heavy military state, especially down where I am in Hampton Roads, Virginia, home of the Navy. And veterans would actually receive benefits through Medicaid expansion. There's different populations of veterans that don't, who are not covered by current military benefits. And so we found out we had probably about 35,000, I believe, veterans that would be eligible for Medicaid expansion. And so that was a good argument in certain parts of the state to make, that it would help them and their families. And so we also made the case just about how this would really financially help hospitals, and especially in rural areas. And again, what that would look like down to each hospital, what would be the impact, who would be covered. I mean, all the data. I know, Jason, you had awesome data. And I say with COVID, I was just looking up our numbers, and it's very similar to North Carolina. I think you're on the right path, that 260,000 because of COVID are now receiving unemployment benefits. And about 70,000 of those individuals did sign up for Medicaid, and most of them were Medicaid eligible through the expansion population. So I just pulled that. So that aligns very closely with what you were saying in North Carolina. And so that's kind of been our experience that we've seen. So 70,000 additional individuals because of COVID and the increase in unemployment have now qualified for Medicaid. So I'm happy to answer any questions, but the business community in Virginia was probably one of our biggest advocates, if not our biggest advocate. And what we did is worked very closely with our chambers and developed kind of guardrails around Medicaid expansion and kind of the expectations of the business community. And I think that really helped to have that, as well as just mostly validators. We called them validators for the need for Medicaid expansion. And some of the larger businesses and employers also got involved, in some of the top CEOs in Virginia. And I really think that push from the business community explaining the benefit was very helpful in our discussion and approval of Medicaid expansion in Virginia. So hopefully this helped with that story, but I'm happy to answer any questions at the end. And again, thank you for having me today on this.
Oh, Anna, thank you so very much. That was extremely enlightening, especially the sort of the myth and fact, because we are hearing much of that down here. I am an American Heart Association volunteer, and the fact that so many people are being treated for high blood pressure. We live in the stroke belt, and the eastern part is in the stroke belt buckle. So you are saving lives directly. That is fabulous. So now, one of my favorite people is going to give us a short presentation next. Tom Keyes, who I was joking with him earlier. He came all the way to Raleigh in the wintertime to talk to the General Assembly, but the General Assembly didn't stay home. They went home. They didn't stay in Raleigh. So Tom, now we have a large group of people for you to talk to. So talk to us about closing the coverage gap as a critical business issue.
Yes, thank you for having me on this panel. The Carteret County Chamber of Commerce is situated on an absolutely stunning part of eastern North Carolina. We're right on the coast. And our Chamber of Commerce represents just short of about 1,000 businesses, organizations, and individuals. And let me just back up just for a minute. I want to let you know that our county here politically is very, very conservative. But we are also tourism driven. That's primarily what our economy is. And the community college has estimated that we have about 7,000 micro enterprises here in Carteret County, and which means those are businesses with 4 or less employees, and that means art galleries, small retail shops, plumbers, carpenters, some contractors, landscapers. And that being said, we have $1 million beach homes, vacation homes here in Carteret County. We have $1 million yachts moored in some of our marinas and the boat waterfront. We have some world-class restaurants. But the people who wait on tables in those world-class restaurants and the folks that clean the hotels and the beach homes and detail those boats are folks who sometimes have 2 or 3 jobs just to pay rent and put food on the table. They are quintessentially the working poor. And our hope mission here estimated, this is pre-COVID-19, estimated that we have a 13% poverty level here in Carteret County. Broad Street Clinic, which is our free clinic, estimates that 1 in 4 people here in Carteret County don't have health insurance. That's over 17,000 people here in Carteret County. We appear to have a lot of wealth here, and in some cases we do, but that's not the case for the entire county. So from a business standpoint, it's really important that we have this gap covered. Those folks who are waiting tables, if they're sick, they're not going to stay home unless they've got to have health care. You don't want sick people waiting your tables. You don't. It's so important now during the pandemic that people are getting health care. So this is very, very short. This is just from my standpoint. I can't tell you what's going on with the rest of the state. I just see it here. And from a business standpoint, it makes perfect sense to work on this project with you folks. And I'll be happy to talk to any other chambers of commerce out there about it. Our board voted a while back to support the House bill that would have covered that gap. And we continue to support it. So once again, if there are any questions at the end, I'll be happy to answer them. In the meantime, I'm going to kind of watch it rain and listen to everybody else speak. Thank you.
Thank you very, very much, Tom. We know this comes directly from your heart. And I love looking into your house and seeing lighthouses and beautiful beach things in the background. So thank you. So our next speaker is someone that's probably known to many of you. Dr. Michael Waldrom is the CEO of Vidant Health. Vidant is clearly a lifeline for healthcare in Eastern North Carolina. And Dr. Waldrom, we know you've got a few things going on with trying to sort of save the world and keep people from getting sick and take care of a lot of patients. So, but we would like to hear from your perspective what closing the coverage gap could mean to Vidant Health. So Dr. Waldrom, if you are ready to talk, I can't see Dr. Waldrom. I think he's off mute, so please take it away, Dr. Waldrom.
Can you hear me?
I can, yes, thank you.
Great. Thank you, Peg. And I just really appreciate being part of this. It's great to see folks that we can't see physically, but and I appreciate Van's comments at the beginning. Really, I appreciate all the comments, but Van, as I'm a board member of the NC East Alliance, and I think that really speaks to why it's important that our mission is to improve the health and well-being of Eastern North Carolina. And I think your speakers, Anna and Tom and Jason, have really already outlined that this is a pro-business and a pro-community position. And I think everybody puts this into just the healthcare lens. And when you think about improving the health and well-being of a community and our mission to improve the health and well-being of Eastern North Carolina, it really comes down to economic development and to education, supporting education, and to supporting health habits and health care. And so historically, Vidant has been, at least over the last 5 years since I've been here, has been active in promoting that this is important and closing the gap and doing Medicaid expansion. And I'm not a politician, so sometimes these terms, I know, like, just saying Medicaid expansion can be viewed as some politically charged term. But I moved here from Arizona, one of the most conservative states in the country. And I was very active in Medicaid expansion in that state before I came here. And we got it through at the inception because, frankly, of what Anna outlined, that this really is a pro-business and pro-economic position. It's not just a healthcare position. But we are the safety net provider for Eastern North Carolina, a rural and highly impoverished and in some cases disadvantaged region. And it's a challenging environment. It's one of the most challenging healthcare environments in the country because of the level of poverty, the historic disparities, and the fact that we're in a non-expansion state. We have seen higher hospital closures in non-expansion states than in expansion states. And that affects local communities, not only to access to care, and that's why I mentioned Van's comments, the other comments earlier, is that we also know that when hospitals close in communities, it's actually the beginning of the closure of that community. That the community literally starts going away. And having been here for 5 years and love our communities and learn to love them, they're such beautiful and rich places. And the sense of community in Eastern North Carolina is so strong, and in rural North Carolina, that's just a huge travesty. So it gets down to providing access to care in these communities that have gone through pretty significant structural changes. So there's a large demographic changing with the graying of rural communities, and that leads to higher Medicare coverage, and then more uninsured. And so our commercial percentage is extremely small. So we essentially are a very large governmental payment source. And as was mentioned, Medicaid tends to pay lower than other providers, but it's clearly better than uninsured. And so the pressures are pretty significant for rural communities. And the fact is that healthcare organizations in non-expansion states have been challenged. And if you look at what's happened in the west side of the state with Mission, they went through, prior to selling, because of a lot of these pressures, closed OB services, because in a number of rural communities, it's difficult, and Van mentioned this, that OB services are very difficult to maintain because they're low cost, low volume, high cost services. But we do know that those type of services are extremely important to those communities. Because if you're a woman in a Hosky, North Carolina, that's pregnant, and you have to drive either an hour towards either Roanoke Rapids or Elizabeth City or down to Greenville, those are pretty scary drives in labor. And we know that when those OB services close, for instance, infant and maternal mortality rates go up. And specifically in African American communities. So there's a disparity issue here. So I could go on for a lot of reasons, but I really appreciated Anna pointing out two of the things that I think are most important from a business community, because I hate taxes, but what I hate more are hidden taxes and my tax money going to Virginia or going to New York City to pay for their health care for their citizens. And that's a travesty for our businesses. And we know that by expanding, that goes away. We have an assessment program in this state that would fund the expansion. We know the outcomes. I know what happened in Arizona, and I know what happened in the other states. And actually, commercial rates have gone down in those states. There's been less hospital closures, and the health outcomes have improved. And Anna highlighted a few of these, but we know one of the national tragedies is the opioid issue, and probably the most significant intervention that can be made for that issue for the citizens is Medicaid expansion. We know that because the outcomes are clear, because other states have already proven those things. So expansion means increased access to care, better health outcomes, and a net savings to the hospital, and our tax dollars being used for the citizens that pay for those tax dollars. So I'm happy to entertain questions, but it just fundamentally gets down to us being able to make sure that our mission lives every day in our communities, and it's so important.
Thank you, Dr. Waldrom. I spend a lot of my time in Farmville, and so I'm very glad to know that Biden is right up the road, and now I'm actually glad to get to meet you. So hopefully I will only come for a social call and not a professional visit. Thank you very much. All right, now it is my pleasure to introduce the Director of Care for Carolina. Many of you know her, and she's one of my favorite people, and you just got a shout out from Jason Gray, and that's a big shout out. Dr. Waldrom, you did a great job. So it's my pleasure to introduce Erica Palmer-Smith, who's going to talk about North Carolina's policy opportunities and give you a sneak peek, or not a sneak peek, a peek at the poll that was released yesterday. And then we will ask John Chafee to wrap things up for us. So Erica, if you want to get started, please proceed.
Absolutely. Thank you, Peg. Haley, if you'll go to the next slide, please. So I want to kind of take us to a positive place here for a moment. Our speakers have done an incredible job explaining why it's so critical that we do something in North Carolina. And what I'd like us to pay attention to now is how easy it would be to actually do something right now in North Carolina. We have a huge policy opportunity that our legislature could choose to act on today. We have the ability to expand quality affordable coverage to nearly 750,000 North Carolinians. We have an opportunity to ensure that all of our frontline workers, the folks that Tom was referencing in the restaurants and hotels, to make sure that they have access to timely testing and treatment for COVID-19 as we work our way through this pandemic. We have an opportunity to stabilize our healthcare system by reducing the amount of uncompensated care. We have an opportunity to provide a lifeline for struggling families who've lost their employment during COVID-19. And we have an opportunity to do this with 90% federal funding. As Dr. Waldrom and Anna both mentioned, we are already paying those taxes. There has been legislation that has been proposed to do this, but none of it has seen a vote on the House floor. The first one I'll mention, House Bill 655, North Carolina Healthcare for Working Families, that both John and Tom spoke so eloquently at a press conference not too long ago. This legislation would have brought down the 90% federal match, would have had some provisions, some work requirements and premium requirements in it, but it would have offered North Carolinians an opportunity to get health care, and it would have done so with a huge amount of bipartisan support. It actually passed through the House Health Committee with a 25-6 vote, had 22 Republican co-sponsors, and unfortunately was not given a vote on the House floor. We've also seen recently filed House Bill 1040, Healthcare for Working North Carolinians, which would expand Medicaid in North Carolina. And we've had House Bill 1103, Access to Affordable Health Coverage for All, which would have provided subsidies for those folks in the coverage gap for private insurance marketplace coverage. So I say all that to again emphasize that North Carolina has the opportunity to do something right now. It's as simple as prioritizing this instead of continuing to put it off while our folks suffer. But not only do we have this opportunity, we know that voters agree with this opportunity. So Haley, I will ask you to go to the next slide, and I will quickly run through a bit of the polling information we released yesterday. We worked with the Stewart Group and Harper Polling to poll a sample size of 612 registered voters in North Carolina on August the 26th through 27th. And what we found, next slide, was that 75%, 3/4 of North Carolinians favor the legislature creating a solution to close the health insurance coverage gap. Only 16% oppose. Next slide, please. This support is bipartisan. You can see here in every demographic that you could think of to look at, voters strongly support. I will draw your attention to, this gets hyper politicized. I mean, if you look at these numbers, 64% of Republicans support closing the gap, 83% of Democrats, and 76% of unaffiliated voters. When you look at ideology, all the way from liberal at 89% over to very conservative at 60%, we continue to see strong majorities in support of closing the gap, regardless of ideology and regardless of partisanship. Next slide, please. We also know that COVID-19 has made a significant impact on this. As you can see, overall, voters were 74% more likely to support closing the coverage gap when they learned more about the impacts of COVID-19 and the 178,000 projected new folks who need insurance because of employment losses due to the pandemic. Next slide, please. Now, you might be asking, well, okay, so closing the gap, but when we start talking about Medicaid expansion, are people backing off? When what we found when we asked about Medicaid expansion specifically was that 77% more voters than responded to the coverage gap question. 77% of North Carolina voters responded that they were in favor of Medicaid expansion, specifically when asked. Next slide, please. That is actually an increase over polling done last year in 2019. Of course, COVID-19 we expect had a great deal to do with this, particularly given responses to concerns about COVID-19 on the poll. We saw a growth of a net 9% in support for closing the gap, or for Medicaid expansion specifically, between 2019 and 2020, from 72% in favor to 21% in opposition to this year. We saw 77% in favor and only 17% of North Carolina voters opposing Medicaid expansion. So I want to emphasize that one more moment. 17% of North Carolina voters actively opposing Medicaid expansion. That is it. Next slide, please. I will also hit on these key demographics. When we looked at this from a, looking at key demographics, what we found was the same thing held up. We continued to see solid majorities regardless of partisanship, regardless of ideology, regardless of any other demographic differences. We saw 61% of Republicans supporting Medicaid expansion, 91% of Democrats, and 75% of unaffiliated voters. Again, we continue to see strong support regardless of these other factors. With that, thank you for hearing a little information about our poll. Happy to answer questions after John.
All right, thank you very much, Erica. That's exciting news and exciting opportunities for Care for Carolina and the people of North Carolina. So our last speaker before we start asking and answering some questions is John Chafee, and he's with Trans World Business Advisors, but he was also the former head of the NC East Alliance. And so we are delighted to have John talk about what business people can do to help move this issue forward. John, it's all yours.
Thanks very much, Peg. Greetings from a hotel room in Richmond, Virginia. So I apologize for my rather blah background, but I'm here for very important business, and that's the birth of my first grandson.
Well done.
So it's pretty fantastic. So anyway, I'm delighted to be with you today. Very pleased to see that we have over 50 people that have attended, at least that many. So that's a fantastic start. I'm here as a member of a new initiative. It's called the Carolina for Care, C4C Business Advisory Council. It's being headed by Patrick Woody, who's the president of the Rural Center. We have a number of people that are already committed from across the state. You see their names, and we've just recently added a couple of additional representatives actually from Eastern North Carolina. One, Tracy Johnson from Washington County, recently joined in, and just found out today that Dr. Phil Brown from Wilmington, who's the incoming president of the North Carolina Medical Society, is a new member, as well as she's not a doctor, Sharon Decker, who is with the Tryon Equestrian Center, but she's also former NC Secretary of Commerce. Next slide, please. There we go. So you see, in terms of, we've been at this for a little bit in terms of picking up support from across the state of North Carolina. Tom Keyes mentioned in terms of, or maybe Peg mentioned it earlier, a number of chambers from Eastern North Carolina, affiliated with the NC East Alliance, adopted a resolution in support of closing the health insurance gap. Actually, a couple of years ago, it was one of their top priorities for the 2 years running, 2018 and 2019. And my assumption is they're still on board with that in 2020. Tom Keyes is a member of that group, and his chamber board specifically adopted a resolution, as well as I know the Greenville-Pitt County Chamber of Commerce did as well. So part of the purpose of this new advisory council is to spread the word, try to basically recruit new people to be able to come in and support the organization or support the initiative. We currently have not only chambers, but faith leaders, business people, hospital organizations, obviously, it's very important to them, as well as local and municipal leaders. So if you would take me to the next slide, please. Here's an example of some of the support that we already have from business leaders across the state, specifically in terms of, you notice several from Eastern North Carolina that have been on in terms of our hospitals, individual business organizations like automotive dealership, as well as real estate professionals that have seen what they believe to be the potential positive impact of expanding coverage in Eastern North Carolina. Next slide, please. We mentioned in terms of a broad base, a number of community civic leaders, including county commissioner boards across the state. We have a couple in Eastern North Carolina that have already adopted resolutions, but certainly out in the far west. Municipalities, we hope to be able to grow both of these numbers substantially across Eastern North Carolina over the course of the next year, actually the next several months. But also not only in terms of those public entities, but other public entities such as economic development organizations. Next slide, please. So how can you actually join the effort to help us close the coverage gap in North Carolina? You go to the Carolina for Care website. It's pretty easy. You just type in Carolina for Care, Care for Carolina. Google it. It'll pop up. Visit the Act Now page. Select in as a business leader or an organization and enter your name and sign on. And next slide, please. And if you do that, certainly Care for Carolina will add your name, give you a little bit of recognition there, but also help us to sell others or convince others that they need to join our team, join the effort to be able to expand health insurance in North Carolina. Next slide, please. But just an example, I think Erica could probably help you if you would like it, if you're not representative, but if you're a county commissioner representative from one of our counties in Eastern and Northeastern North Carolina. Here's an example of a resolution adopted by the Pitt County Board of Commissioners actually some time ago to be able to support the expansion of health insurance in North Carolina. Certainly as Jason's number showed, and again, kudos to Jason and Anna for some incredibly informative and relevant information to share with everybody. I hope we'll be able to make that information broadly available that you can use to take into your communities as well. Next slide, please. Chamber of Commerce resolution, Tom Kais, thanks very much for sharing yours. So we'd certainly like to see more of our chambers sign on, and specifically, again, not only in terms of taking it to their chamber board members, but actually take it out more broadly within their own communities and share this information with their individual membership so that we can, again, continue to educate members of our communities across Eastern North Carolina about what the positive impact of expanding health insurance would mean to our communities in Eastern North Carolina. So with that, I'll wrap up the element of it and mention that I'll look forward to working with members of our Business Advisory Council. We're still working to add additional representation to be able to make sure we've got good, diverse representation on the board from several different backgrounds. Dr. Meg Malloy has been sharing information over the past year. And Meg and I and Erica and others will be happy to help you get information to your board or to your memberships so that we can actually advance this cause this year and bring some positive economic news to many of the counties in Eastern North Carolina. Our goal is to have not only civic leaders, but also business leaders from all 100 counties by the end of this calendar year. So please, if you would, take the message out and let us know if you're interested in spreading the word and if there's a way in which we can help you get that done. So thanks. I'll turn it back to Peg and let you handle the questions, Peg. Thanks very much.
Very good. Thank you, John. And thanks to all our speakers. You did a magnificent job. So we do have some questions coming up in the chat box, or you can raise your hand and I will hopefully not blow up the computer in trying to do all this. But before we move into questions, I just want to say thank you so much to someone that John mentioned, and that is Dr. Meg Malloy, who has been reaching out. Many of you have had her calling you and asking you to become involved. She's really the brain trust behind the Business Advisory Council, and once Meg gets a hold of you, she will not let go. So Meg, thank you for helping put this all together. And then to the folks at the NC East Alliance, I want to just say thanks to, again, to Van and Hannah and to Trey. You guys did yeoman's work for inviting all your friends. And we will look forward to doing a lot more work together. So where we are is, let's see, I'm in the chat and I see we have Sarah Bernhardt. Yay, I've always wanted to meet Sarah Bernhardt. Erica, I'll let you take this one, and then we've got a couple of questions from John to the other panelists. So from Sarah Bernhardt, so what is the opposing argument? Why are some of our members in the General Assembly so opposed to Medicaid expansion? I think that's for you, don't you, Erica?
I'm happy to answer. So I'll tell the two arguments that we tend to hear the most from legislators. I will also take the opportunity to say why, in my opinion, they don't necessarily stand up to the discussion. So the first that we hear quite often is that the 90% could go away, that the federal government could up and decide they don't want to cover that anymore and leave North Carolinians holding the bag. Here's the problem with that argument. It ignores what's actually written into the legislation. So the Affordable Care Act specifically states that the 90% will be covered in perpetuity. There is no changing the 90% number without going in and changing the Affordable Care Act. I think that we have seen how that goes when there is an attempt, but Congress would have to act and a president would have to sign new legislation to change that 90% number. That is not a real concern. The second one that we hear quite often is that concerns that there are folks who aren't necessarily deserving of having this coverage, that people are choosing not to work, and therefore we would be covering folks who are not taking care of themselves. The reality is that 63% of these folks are working. I think another reality is that the giant increase that we've seen in the coverage gap population has been due to working folks losing their coverage because of a global pandemic. These are people who are working daily to take care of their families. You know, one thing that I'd like to mention, we are talking about people who aren't making above the poverty line. So we always hear this phrase, childless, able-bodied adults. But when we're talking about these folks, a quarter of them are parents. If you are in North Carolina and you make above 42% of the federal poverty line with a child, you're not eligible for Medicaid. For a single mom who has a child, has one child, for her to qualify for Medicaid, she would have to make less than $7,200 a year. If she's working 40 hours a week at minimum wage, she's making nearly double that, but she's not making nearly enough to get coverage to get a subsidy in the private insurance marketplace. So a full-time working mom gets no help. So those are the folks that we're talking about. We're talking about the people that Tom referred to who are working in the restaurants, who are working in the hotels. We're talking about the backbone of rural North Carolina, the people who are doing important jobs to keep our economy moving. Those are the folks who are suffering right now, and those are the folks that we need to take care of. So those are the two arguments we hear most often. Again, from what we see, those arguments don't hold up.
Thank you, Erica. Sarah, I can see your face. Is that a good answer for you? Very good. All right, we will go to the next question in the chat box. This is from John Chafee to Jason. I assume the numbers cited for employment impact are by place of work. So speak to the spread of both negative and positive impacts of expansion on rural counties surrounding Pitt County. Jason, can you handle that?
Oh, I think I can field that, and it's always great to be pitched a question from John. John would make a very good attorney because he knows how to ask questions that he already knows the answers to, which is what attorneys are good at doing.
That's what they teach us.
And he is quite correct that the data shows from the location of the job. And for example, I had the individual county data for Pitt County in terms of the economic impact, the number of jobs, 547 jobs. And certainly Martin County, Washington County, Greene County, perhaps spilling over into Edgecombe County, which touches Pitt County just a little bit. No doubt there are people from those counties commuting into Pitt County. Pitt County is an economic engine for the region. And while the numbers there show for Pitt County, it has a spillover within the region. Good question.
Very, very good. All right, let me look and see if anybody has raised their hand, and then I will. Okay, good. I want to make sure I wasn't missing anybody. Oh, Anna Bess Brown from the great city of Ahoskie. Please.
Thank you, Peg. Hi, yes, I'm Anna Bess, and I grew up in Ahoskie, and I wanted to raise a kind of echo your comments, Peg, about the fact that North Carolina is in the stroke belt and Eastern North Carolina is in the buckle of the stroke belt. And we know that access to health care is the greatest thing we can do for prevention. A lot of stroke and heart disease, which are, lifelong and costly for a lot of people, can be prevented with regular checkups. So if we can improve access to care, then we can, prevent a lot of heart disease and stroke and get more people back in the workplace, et cetera. So thank you for letting me comment.
Very good. Thank you, Anna Bess. It's always good to see you. All right. I have another question from John to Anna. Do you have any data? Anna, this is for you. Do you have any data or anecdotal information on changes in absenteeism from employers since the Virginia expansion? John, that's an excellent question. So can you unmute, Haley, can you unmute Anna?
Great. Can you hear me? Okay.
Yeah.
And that's a great point. And we haven't done the data yet exactly as it relates to absenteeism, but that was one of the points that we made for Medicaid expansion, is that 88% of our businesses have 20 or less employees, and they're most likely not to cover their employees. And so a lot of these are kind of lower income, think restaurants, lower income individuals that would have qualified for Medicaid. So we did it on that piece, but we haven't followed up to see if, the productivity or an increase in productivity in the workplace or a decrease in absenteeism. That's good. I'll have to put that on my list of something to do. That's a great question. But one of the arguments we did make was about the number of small employers that we did have in Virginia. And so 88% have 20 or less employees. So
very, very good. Thank you, Anna.
And if I could just add, to that, Peg, in Sparta, there's a manufacturing facility I can't recollect the name of it. It's a story's a couple years old now, but the local hospital system, this manufacturing facility was having a lot of absenteeism. Many of their employees didn't have health insurance. They didn't have access to a health clinic. So the hospital built an outpatient facility right near this manufacturing facility. And I don't know whether they subsidized or what the arrangement was, but the result is that it dramatically drove down absenteeism at the facility. So that access, both in terms of insurance and in terms of physical access, makes a big difference for the workforce.
Very good. So thank you, Jason. We are coming close to our time, and I think, is that Dr. Waldrom?
Yeah.
Yeah, please.
I want to just, actually, both of those comments, I appreciate Annabeth Brown's comment. And I think that, we talk about hospitals so much, but I think that we haven't talked about physician and physician recruitment to rural communities so they can have access. And I think it's ironic that we're talking about a lot of cases, Northeast North Carolina. And if you're a physician and you want to live in a great rural community, let's say on a coastal plains, you may want to go north of the Virginia, the line there, because if you're going to try to make your living and you want to provide access, you're going to have people that are covered. And so it really helps us recruit physicians, not just employed physicians, but physicians to rural communities if they know that they're going to get paid for services. And I can tell you that's a big thing for Hosky, North Carolina. One of their iconic physicians there, I don't know his age, but it's well into the 80s, and we have trouble. Kim Schwartz is actively trying to get folks, and we're actively trying to get folks, but having coverage helps get doctors to rural environments, not just hospitals.
Very good. Thank you, Dr. Waldrom. We're at the end of our time, so I will take the moment to tell you that Erica and Meg will be in touch with you with follow-up information if you want to sign any resolutions. Amy, I noticed your comment. We will send you, Amy, I think you were actually Annabeth's neighbor growing up, so small town of Hosky. We will make sure that everybody gets the slides and resolutions, that your own data from your own counties, so you can see the actual impact that this will have on Hertford County or Perquimans or Tyrrell, or some of the bigger counties, Carteret. So you will have your data, and we will hope that you will look for the opportunities to make action steps. Obviously, we will suggest some of those to you. So all, thank you for your time. The chat box is full of beautiful shout outs to the speakers and to the organization. Again, Dr. Malloy, you are a genius for pulling this all together, and to all our speakers, we cannot thank you enough. I think we are concluded, and Dr. Waldrom, you saved some lives. Tom, John, Van, you saved some businesses, and things will be good. So thank you all for your time, and I think we are adjourned.